Hello and welcome to this lecture. Today we are going to discuss the important topic which is breast cancer. And when we talk about the etiology or when we talk about incidence of breast cancer, 2010 it is found that 200,000 invasive breast cancer has been diagnosed in women in the United States. 40,000 women have been died with this disease. Second important disease after the lung cancer, or the second disease that is leading cause of death in the woman. The lifetime risk of developing breast cancer in women, especially in the United States, is 1 to 8%. 1 to 8 for women. During the past 3 decades, the mortality rate is diagnosed with breast cancer have been diagnosed and dropped. So during past 3 decades, the mortality rate among the diagnosed with is dropped from 30 to 20% because of the improved screening and treatment now.
While breast cancer can occur in any part of your breast, it is more likely to be found in the ducts and lobules. Ductal breast cancer starts in the cells that line the milk ducts. Lobular breast cancer starts in the cells that line the lobules. Breast cancer is also described based on how likely it is to spread to other parts of the breast or body. It is called either non-invasive or invasive. Non-invasive breast cancer is breast cancer that usually does not spread. Your doctor may call this ductal carcinoma in situ, or DCIS for short. It stays in the ducts or lobules of the breast. Occasionally, when a biopsy shows DCIS, other types of breast cancer may be found at the time of surgery. Invasive breast cancer is much more common. It can spread to other parts of the breast, lymph nodes, or even other parts of the body. Most invasive breast cancers, about 8 out of 10 cases, are invasive ductal cancer. Far less, only 1 out of 10 cases, are invasive lobular cancer.
Histologically, it could be classified into non-invasive and invasive. In non-invasive, it could be classified further into ductal carcinoma in situ or globular carcinoma in situ, which can be abbreviated as DCIS and LCIS. And the invasive carcinoma, it could be ductal in nature, which we call that invasive ductal carcinoma, and it could be as invasive lobular carcinoma as well. So let's discuss one by one. When we talk about ductal carcinoma in situ, the structure look like a solid comedo, crabbiform, papillary or micropapillary clinging types. So this is the architectural changes like crabbiform. I already discussed that the cheese-like structure, that having cheese look like very small hole and big hole. So the histopathologies look like the crabbiform appearance. It could be from the papillary or micropapillary types, or it is also responsible for the formation of comedo architecture. What is comedo architecture? It could be explained in terms of the central necrosis. If I draw the picture like this round structure, so the area of necrosis lies in the center, surrounded by the neoplasmic cells. So there will be the number of neoplasmic cells surrounding between the necrosis, and it could be explained in terms of the comedo appearance, and usually occur in the neoplastic cells in the duct. To understand this, let's see this picture. The first one is a solid tumor where there is lot of tumor cells surrounding in the architecture. Then this comedo pattern where you can see the central section is a necrotic zone, and surrounding them is actually the cells, the neoplastic cells. Then the papillary cells, which projected look like papilla formation, they have finger like projection, this structure. Then we have the fourth one, crabbiform, where we have been present in the form of small and big architectures. And when we read this picture, I found somewhere, so they mentioned that the comedy pattern is like central place necrotic debris surrounding the neoplastic cells in the duct. Papillary pattern look like intraductal papillary projection that have no or less of fibrovascular stalk. Then we have crabiform pattern, which consists of like intraductal tumors. When we talk about lobular carcinoma in situ, it having a uniform appearance. They are monomorphic in nature, having bland round nuclei, usually occur in cohesive clusters within the lobules, and they are intracellular mucin containing vacuoles that forming signet ring cells. What are signet ring cells? We already discussed that ring like structure. Approximately 1/3 of the women suffer from lobular carcinoma and eventually develop into invasive carcinoma. And this is that lobular carcinoma is a precursor for a number of cancers. The treatment could be given with the use of tamoxifen and chemotherapy. We will discuss in pharmacology. Follow-up will be the radiological and the surgical removal of commonly known as mastectomy. This is a picture of lobular carcinoma. Then we have invasive ductal carcinoma, having majority of 70 to 80% of the cancer fall in this group. It is also associated with ductal carcinoma or sometimes rarely as lobular carcinoma, and they are responsible for the production of desmoplastic response, having abnormal change in the breast or the mammographic density. Formation of the hard mass or palpable mass will be found in invasive ductal carcinoma. So they are also responsible for the production of crabiform appearance, having monomorphic nucleus. This is another picture of moderately differentiated carcinoma, less tubule formation and formation of solid nest. And this is another picture of poorly defined carcinoma with pleomorphic cells containing numerous mitotic cells, and the area of necrosis will be found. And the reason behind invasive carcinoma or invasive lobular carcinoma is because of the mutation of E-cadherin. What is E-cadherin? E-cadherin is important actually for the adhesion or cellular adhesion of the epithelial cells, and the mutation occur in the E-cadherin is responsible for the problem. So the lobular carcinoma have a unique pattern of metastasis, and they can spread through cerebrospinal fluid, serosal surface or gastrointestinal tract or ovary, uterus or bone marrow, and they are more frequently multicentric and bilateral in 10 to 20% of the cases. So this is a picture that I was discussing about E-cadherin, and they are responsible for the adjoining of the epithelial cells like this finger-like projection. So cadherin is important for the adjoining of the epithelial surface, but because of the mutation it could be responsible for the cancer. Then we have the Paget disease, which is a rare manifestation of the breast cancer, usually occur in 1 to 4% of the cases, and it could be production of erythematous, which mean the reddish eruption and with scale crust, and sometimes it is difficult to diagnose with pruritus and mistakenly misdiagnosed with eczema, but they are different from eczema. They are malignant cells extending from the ductal cell carcinoma, so they are affecting the ductal system of the breast cancer. Within the ductal system through lactiferous sinuses into the skin without crossing the basement membrane. So it disrupts the normal epithelial barrier, allowing extracellular fluid to seep out to the surface. And then the Paget cells, these are readily detectable through biopsies and cytological preparation of the exudates. And usually this disease present in 50 to 60% of the women already having an invasive carcinoma, having poorly diagnosis and usually occur because of the estrogen receptor negativity or the overexpression of the gene HER2, and majority women that having this disease is only because of the ductal cell in carcinoma without having the palpable mass. So the Paget disease is sometimes patient don't have the palpable mass and having the disease of the ductal system actually, or the ductal malfunctions. This is another picture how it look like. So the outer layer look like the presence of the crust, and that crust appear, and the outer surface consists of the Paget cells inside the epidermis. So these Paget cells will be present inside the epidermis, and there will be the involvement of the ductal system, and you can see that the ductal system will be involved by the DCIS. And we mentioned also that malignant cells extend from the ductal cell within the ductal system, as we see in the picture, through lactified cyanosis into the skin without crossing the basement membrane. So they do not cross the basement membrane. If you see, this is the outer layer consists of the basement membrane. So they do not cross the basement membrane, but they are still responsible for the invasion, usually through the ducts that has been involved, and they can be extended up to the lactiferous ducts into the skin of the surface. So what will happen that it can seep out to the skin surface and forming the crust appearance, commonly known as scale crust on the skin surface. So thank you so much for today's lecture. Hope to see you again.